a new facility which is a cutting edge technology in the treatment of varicose veins, which has been started in Goa Medical College. And with me I have Dr. Pawan Kumar, who is an expert interventional radiologist. So the incidence of varicose veins in state of Goa is almost 20 to 25%. I suppose you know what is varicose veins. It is a condition where the veins of the leg become very tortuous, they become bluish in color and they become very big, and they do not function normally. The normal function of the vein is to return blood back to the heart, and this small thing which is seen causes a lot of dysfunction in the lower limbs, and this leads to symptoms like itching, it leads to symptoms like discoloration of the leg, and also ulcers. The varicose ulcers are the wounds which do not heal. The earlier treatment for this means, or all these days what we were following is to ligate the incompetent valve. So there is something called as a valve ligation surgery. So this is a surgical treatment where we used to ligate the valve of the big vein and also ligate the perforators. And there was one surgery which is still followed called as a stripping of the vein. Now these are all big surgeries, they are all invasive procedures, and hence many of times these patients get recurrence, and they want they feel that these surgeries are a little bit painful. So now what we have done is we have introduced a machine which is called as endovenous laser treatment machine. Now this machine you can use through a small hole of 2 millimeters in the vein, and you put a fiber of a laser inside the vein, and you send the laser waves and you coagulate this vein, you contract this vein and reduce the size of the vein, and this becomes your treatment, and the recurrence rate after this treatment is very low. That means only 2% people can get it again and might require a second time laser. But the advantages here is there is no big surgery, there is no cut that is given, and the patient can resume the work next day. So we wanted to announce this state of art treatment varicose vein because there are many patients in state of Goa who are waiting for this treatment, and through your media we wanted to announce it. Our Honorable Health Minister, I informed him, and he said that this is really a great thing that Goa Medical College is doing. He has congratulated the institute, and he said that he cannot be a part of this basically because of code of conduct. So I would now request Dr. Pawan Kumar as an expert to speak on the subject as per se. So Dr. Pawan.
So basically what happens in varicose vein, the person who work like standing, like chef, or person who are like driver or a teacher, when they stand for long hours like 8 hours, 10 hours, 12 hours, then the blood get collected in the vein. So the pressure in the leg, in the vein, it increases too much. Then with this blood column will form, and after that, after certain time, that the valve become dysfunctional. So will become more and more dilated. So blood is not going returning to the heart; it is cutting the vein in the leg. So it will cause the swelling of the vein. Then after that, it will cause the discoloration of skin, and after in the late stage, the ulcer can become, which is called as venous ulcer. That is the
These ulcers do not heal on their own, and it is really difficult to treat these ulcers. So once you now do endovenous laser therapy, these ulcers will heal very fast, and then patients, the blood which gets collected in this venous system, it becomes kind of a stasis and does not go into circulation, will go back into circulation. So there are many advantages of this, and I feel that Government of Goa has given us this machine. The Minister of Health said that you go ahead, start this unit, and We started this unit just 3-4 days back,
Yes, sir.
and we have already treated about 24 patients, and they are happy about it.
तर असे कितले पेशंट तुमच्याकडे हाजे पयलीं येयले सो
This incidence is almost 20 to 25%. म्हणजे आमच्या ओपीडी दिसाक काय ना म्हटल्यार म्हज्याच ओपीडी ऑर्थोपेडिक ओपीडीची काय ना म्हटल्यार म्हाका 5-6 तरी पेशंट येता आउट ऑफ 35-40 माय ओन ओपीडी Actually varicose veins is treated in general surgery OPD, but sometimes they feel that शीर दुखता म्हटल्यार ऑर्थोपेडिकाक दाखोवपाची. So it is so high incidence, and it is not only the incidence that bothers us. What bothers, till date there was no proper kind of a solution to this. Means we were doing multiple procedures and the recurrence rate used to be high, and then again patient satisfaction was not much. Thirdly, patient used to be away from the job. Now here if you do a endovascular laser, patient can join the duties immediately next day.
दोतोर हे आता एंडोस मस्क्युलर केलं की दिसाक कितले करपाक शकता तुम्ही
How many
पर डे?
How many you can do per day?
Per day, like last Saturday we did 4 cases in a day. So things that like we have other disease condition, this varicose vein is like not a life threatening, but it increases the morbidity. So in
No,
that
but
way,
in that machine, suppose you have no other this.
then we can do around 10 cases in a day.
We can average do 10 patients, but what happens? We have a separate now cath lab for only peripheral vascular disease. This is the only medical college which has a separate cath lab for other vascular diseases. So there are some life-threatening diseases called as aneurysms. So if we do them, that cath lab remains busy. That's why he is saying that he has done 4 because other cases were more emergency. But if there are no emergencies hard pressing on that day, he can easily do 10 patients per day.
This machine is specially for this only.
Yeah, this machine is only for veins.
Sir, machine 20 lakh with 5. The machine cost is 10 plus we need laser fiber. So we bought around 50 fibers.
Yeah.
एका पेशंटाक कितलो कॉस्ट खर्च जावं येता
How much?
Here,
Treatment is
ट्रीटमेंट फ्री बट कितलो कॉस्ट सारका
around 70,000 to 1 lakh. Depend on hospital. Minimum is 70,000.
Outside, I think the patients are paying almost more than a lakh. But here we are doing it free.
Free.
But it is going to cost government about 70,000 because one fiber is used per case. That fiber is costly.
Fiber is not
25,000.
What are the symptoms के देखना है?
Symptom varicose vein, I think most of you must be knowing. शिरे मोठे
शिरे
जाता
मोठे.
लुईस जाता आणि फाटल्यान येद्या दिश्टी पडटा येद्या व्हडले दिश्टी पडटा चडशे बायलांक जाता ड्युरिंग प्रेग्नन्सी then if you are obese, if you are fat, obesity is one reason. Then as he told you, standing profession like musicians, guitarists बी सगळे असता पळय तांकां जाता टिचर्सांक जाता आमचे सर्जन्सांकूय जाता one who does long like we do spine surgeries for more than 6 hours. So it is quite a common condition. That is why this thing was needed. And we made a study, we saw people were going outside of the state because we had this machine was not there, but we procured this machine, and the machine plus the disposables, as of now we have spent 20 lakhs.
Are there any side effects for a treatment?
No, it's very safe. Safe, no?
Yes, sir, very safe.
So that's why expert is with me, he's saying it is very safe. And laser therapy in no way has, see, the laser therapy used in retinal detachment in the eye, and it is so safe. There is no other therapy safer than laser therapy in medical treatment.
Yeah.
So there is a specific age group where varicose veins are seen.
Mostly we see varicose veins after middle age. Youngsters we have hardly seen. We had seen one musician who had very big veins, was very young, below 30. But mostly it is after 35-40. No?
Yes, sir. Long standing work hour like 10-15 years लगातार which is like suppose teacher 10-15 year teacher profession and study for 10 hours per day. Then we will get.
त्यांचे किती abundance
आता आम्ही फॅसिलिटी चालू केल्या न्ही सो नाव पेशंट्स आर वेटिंग मीन्स पेशंट कम टू ओपीडी दे गेट ट्रीटमेंट नॉट नन ऑफ देम आर सेंट बॅक सो वी हॅव डिफरंट थेरपीज लाईक मेकॅनिकल compression, stockinets, all that is going on. Now out of this patient we will be selecting for laser therapy so that the worst cases first. Those who have grade 1, there are grades of varicose veins. So those patients who are really suffering, we'll prepare a list. Now we'll issue a circular to all departments where these patients are landing, like ortho, then general surgery. And now these patients will go back to the intervention radiology OPD. And Dr. Pawan will see them. And he will decide which one gets a priority. So we will definitely have a big list now. As of now, we have not got a list.
How much time it takes for this radio treatment?
One patient, how much?
1 hour.
1 hour.